Well, good afternoon, everyone. Welcome to another segment of Mental Health Moments. My name is Linda Golick. I'm the Health and Wellbeing Consultant at Bellin Health. So happy that you all decided to take some time out today and be with us for another great discussion on mental health. So today, as always, we have our behavioral health therapist from the Bellin Psychiatric Center, Charles Latour. Charles, how are you?
I'm good. How are you doing, Linda?
Doing well. Thanks so much.
Sure.
And in addition, we have a very special guest today, although always a part of our planning sessions as well for these segments. But today we're joined by our team leader of population health, Jody Anderson. How you doing, Jody?
Great. Hey, everyone. Fun fact, does everybody know that Linda and I actually share an office, and she sits right over there?
Yes, we do. We are office roomies. It's too fun some days.
Yeah. Hey, Charles.
Hi there. I didn't know that. That's a fun fact for me, too.
Learn something new every day. Well, we are just really, I don't know if excited is the word, but the three of us are feeling extremely passionate about today's topic. And really want to thank Charles for coming to the table with this idea and some really great background. And then we were able to really flesh that out. But a really important discussion today. So Charles had come across a TED Talk by Dr. Nadine Burke, and she is a physician that is really well known for her attention to ACEs, adverse child experiences, and the health outcomes that happen because of these experiences. And so we really want to have the discussion of what this means from kind of that mental health perspective, but as well as a physical health perspective. And we're going to expand on that today. So, Charles, I want to start with you. You were the one that brought that video to our attention, and we started talking about it. What made you think that this was an important discussion that we should have on mental health moments today?
Yeah, a lot of things. I'll tell you specifically because part of the way my treatment focuses, it's around the topic and theme and theory of attachment, what leads to great attachment in relationships, so on and so forth. And from what we know, the greatest impact on attachment is trauma. And where does trauma come from? And a lot of it comes from childhood experiences and these things that affect our health. And we've talked on this program over the years of events in our lives that happen and what are those events? And do the events in our lives define us, or do we define us by how we respond to those events? And sometimes the most noteworthy events that happened in our lives happened even before we had the capability of being able to manage them like we may throughout our adulthood. But some of these events happen so early in life, shape our events that follow that, sometimes and most oftentimes without even knowing it. So there's so many different ways that this affects us, and I just thought it would be a really helpful thing for us to talk about. One other thing is because a lot of people, even though the study that really launched this whole theory of ACEs, adverse childhood traumas, experiences, which is where ACE comes from, is a lot of people that I talk with are unfamiliar with it to begin with. So I thought, what a great thing to be able to have a chance to explore in this time that we have today.
What's really interesting, and even you as our audience can do this, you can Google ACEs test, and you can go out and you can see the questions that one would answer, and you get an ACEs score. So it will give you a score of how many things, maybe in your background or someone that you're connected to, what their background looks like. So it's a way to kind of understand what that is about. Jody, really excited to have you here today because so much of your work is really connecting to the community and seeing how these things are impacted right here in our Bellin region and in our backyard. And I know that you were really passionate about discussing this as well. So I'll let you kind of take it away and explain to the audience, your perspective on this very important topic.
Yeah, sure. Thanks, Linda. And I think, zooming out from where Charles left off with the kind of individual view, I'm looking at it from the population health view and across our entire region. And how do ACEs impact the health of our communities as a whole? So what are the outcomes that we're seeing because of the ACEs? And then more importantly, what can we do about it? What can we do from a program perspective, a policy perspective, and also that partnership? So I think the first thing is to look at the data, understand it, notice what you notice, and ask the question why, versus looking at just the problem or the pathology, but really peel back those layers to understand the why, from both an individual level, but as a broader community perspective. And I think what fascinates me most or concerns me most about ACEs is that they have that compounding effect. So the more you have, the more, it's like an exponential effect that you can have negatively from ACEs.
Absolutely. And this TED Talk video that we're going to be referencing, and I'll put the link in the chat, and we'll also send it out with the recording so you all can take the time too, where Dr. Nadine Burke really went into some of the data and some of the really, quite frankly, startling data of when there are these increased events, the increased likelihood of so many diseases and so many health issues, including anything from pulmonary issues to a higher rate of suicide and all those types of things. So this particular doctor now really wraps her practice in a very different way based upon what she knows about the background of some of her patients. So Maureen, I don't know if you want to bring up that slide with some of that interesting data that's included. And Charles, I will let you speak to what is on the slide.
Sure. So, dovetailing with what Jody was just capturing is this is a very much an individual and family, but even more community, and I'd even argue national and beyond type of event, something impacting us, the ACEs. The Nadine Brooks is the physician that Linda was just describing, and who did a TED Talk. It went viral. I loved it. Pretty amazing stuff. She had described this phenomenon of if we had something going on in our community, and we thought, okay, it's impacting people on a dramatic level. It's doing this, and this. What would we be doing about it, right? And we would want to know what that is. We would want to do everything we can with it. And if it was asbestos poisoning, lead poisoning, other things, we would do everything we could. But in this case, we have this study, and the particular study that we're referencing here statistically was a study based, it's basically, when you think about ACEs, is an epidemiology study. And 17,500 people were given this test. I think it was conducted with Kaiser, and 17,500. And they were asked basically just to say yes or no. Here is a list of adverse childhood experiences. Just say yes or no. And what they found out was, first of all, 67% of the population has had at least one adverse childhood experience. But what they also found in looking at this and broadening it out is that those who had 4 or more adverse childhood experiences, were 3 times more likely to develop lung disease, 14 times more likely to attempt suicide, 4.5 more times likely to develop depression, and then develop 11 times more likely to have intravenous drug use or abuse, more likely to have begun sexual promiscuity at an earlier age, 2 times the level of liver disease. And to me, the reason this is, all of those have something to do with mental health, right? But as Jody was talking, this is physical, community, overall health. People with 6 or more have a life expectancy that might be 20 years less than those with less adverse childhood experiences. So this is like a major, major, almost like an epidemic in our world, but it's silent. We basically never really hear about it. You almost have to go and find it to really hear that much about it. But there's one other thing I want to say, and why I think what Jody was saying is so important. I see these things happen on an individual micro level. Someone might come into my office, let's say they're in their mid 20s or mid 60s, and they talk about events that had happened to them over time. And you could go back in time and see these early childhood traumas and experiences that have had such a great effect over time. But the example that I like to use, she uses a great example in the video, which is when you're, let's even say in the medical world, if 100 kids drank from a well and 98 of them got very, very, very sick, you could do one of two things. You could write a prescription after prescription after prescription for those illnesses, or you can go over and say, let's find out what's going on with this well and how it's affecting so many kids. It's similar to a construct, the upstream philosophy that we talked about a while back, where if kids are drowning at the lower end of a river, you could keep trying to rescue them, or you can go upstream and figure out who's throwing these kids in the river to begin with. So there's a preventative measure that we have to look at understanding this as well, but so many other things. So Linda, even if you could go to the next slide. So Dr. Robert Block says adverse childhood experiences are the greatest single unaddressed public health threat facing our nation today. I personally couldn't agree more. The better we know about it, the better we understand it, broaden our awareness and understanding, the better we're going to be. Because when you really put it all together, at the end of the day, these adverse childhood experiences, really more than anything else, what it all funnels down to is like almost anything bad in life that you could think of, you are more at risk. There's a dose response relationship. The more of these you have, the more at risk for the bad things in life that you could think of. And to me, the one that most blows me away altogether is that this is probably as important to your overall health, that even, for example, heart disease or lung disease, you might be more at risk for the number of adverse childhood experiences you might have than you might be from smoking. So I hope that puts it in perspective.
I agree, Charles. I think that, and thanks, Linda, for putting the ACEs test in the chat. So I would encourage folks to just double click on that and take a look at how ACEs are defined. You can see there that, people who experience, whether it's physical, sexual, even verbal abuse or emotional neglect, separation and divorce. Just think of the divorce rate and the number of children living in single family homes or that don't have the support of both parents, family members with mental illness or family members who have an addiction or substance misuse problem. Incarceration is a huge ACE for children, meaning that their parents have been incarcerated, and then also just being witness to that abuse. So I was able to take some time to review some of our Bellin region data on ACEs and some of the influences that are happening around ACEs. So some of the information that I uncovered was directly related to, the number of children. At least 1 in 7 children, or 14%, have experienced child abuse and or neglect in the past year. And oftentimes we underestimate those numbers, and that children living in poverty experience more abuse and neglect. And if I were to show you a heat map, definitely within the Bellin region, and I'm sure beyond the Bellin region, we all know that there are children living in deep poverty. So I'm not just talking living just below the poverty line, but living in deep poverty. And an example that I shared with Linda this morning is just being able to afford the simple necessities that we may all take for granted, whether it's food or transportation, having, parents there to support you. But definitely, as Charles had referenced, the public health crisis element of this is very real, and starting to have those conversations about what could I do as an individual. So many of us on the call today are within healthcare, and we have, a lot of great clinical providers here. And I know here at Bellin, we address many of these, maybe not all of them comprehensively, but we do address asking some of these questions in our social determinant questionnaires. But then what are our actions? So not just looking at the data, but taking action maybe at a personal level, maybe it's at a bigger, more community level or a system level. And hopefully in the future, we'll have some additional recommendations for you at one of our upcoming mental health moment sessions.
We really feel like this is such an important topic that we're going to have some additional segments that are going to be connected to this. And we're going to talk about some opportunities out in our community to get involved that you can make an impact. And we're also going to look at what Bellin does in a future segment. So stay tuned for that. That'll be a part of some of our summer segments. So one thing I wanted to point out, so many layers to unpack there, but one of the things that I thought was very poignant and why this really should speak to all of us, and if you watch the TED Talk, you'll see this research was done, and it was 70% of the people that they had found this data from were Caucasian, and 70% were college educated. So these ACE events really happen across everywhere. And it's why you can start to see that this isn't somebody else's problem. This is really something that is in our backyard, and particularly with the data that Jody is showing, you can start to see how this really is hitting home. And we do have these challenges, not only somewhere else, but really where we are located. And that's why we felt it was just so important to bring the conversation to life. Charles, the thing that I thought was really interesting, but really scary from a mental health perspective, is that there's actual brain development that is different when people experience these ACEs, these events. Can you expand more on that and help us understand that?
Sure. Yeah. To me, that's one of the most important parts of this. And some of the things I see very, very consistently is to even understand where I'm going to go with this. I'm going to give everybody an example that we could relate to, is when something in our life has impacted us and created what we know of and we've all heard of, is this thing called the fight or flight response or the freeze response. So if we have a major trauma or a very significant thing that just happened to us, he describes kind of the bear in the woods dilemma. If you're hiking and you're in the woods and a bear is coming to attack you, you basically have your autonomic nervous system, your whole physiology, your biology response to stress and threat gets immediately activated. And you're going to do one of two things basically. You're going to flee or you're going to fight for your life with this bear, right? And hope you get out of it alive. And that fight or flight, that stress response that we biologically have as part of our autonomic nervous system is a wonderful thing to have because hopefully it will help us survive this horrific encounter. Great if you're walking around in the woods, not so great for you if every day you are facing that at home or at school or in other aspects of your life, right? So when we have this actually going on and we have that system activated time and time and time and time again, and every day it seems even more problematic, that is why it has this effect on us that from a stress response, anxious response, we're always ready for that next threat. We don't have that time to dial it down. We don't have that time for emotional regulation. We always feel dysregulated. When's this next threat going to come at us? And the earlier that starts and the more chronic it is, that's why it has all of this mental and physical toll on us later on in life. So if your baseline level of heartbeats per minute basically was 70 to 80, but you have something like what I was just describing going on for days, weeks, months, years, all of a sudden that goes up to like 80, maybe it goes up to 90, maybe it goes up to 100. And we're always in that fear-based, stress-based response, much more anxious, and it takes away from our quality of life and eventually gets to the point somewhere along the way, either early on or later, where it's just so overwhelming that I can't do this anymore. I don't want to do it. There's no way I can keep dealing with this the way I've been dealing with it. How can I get some help? And that's when we start getting some help, whether that's clinical, professional help, or we're doing something else about it, that we start to calm that dysregulation down, factor more regulation into life, learn to have the coping skills with it. And that's a lot of what my day has spent doing, is identifying what the threat feels like, where it came from, where it started, just a safe place environment where people can come in here for an hour a week even. That alone is the start of it. I'll often have people tell me, wow, just from doing, just the fact that I came in here and talked about this and felt calm and safe doing it, in and of itself feels like a great start to working on the adversities and the traumas that I've had in my life. But it's overcoming that overly sensitized threat response and being able to see, okay, either they are there and this is how I'm going to manage them. But for a lot of people in adult life, some of those threats have gone away, but they still have the feeling that it's always going to be there and I'm never going to be able to shut it off. And part of the process is learning how to quiet it down enough to be able to shut it off. We may never be able to erase the trauma, but we'll hopefully always be able to define who you are and what you're going to do about the trauma you've had. So create the agency for greater regulation.
Absolutely. One of the things that I came across because of watching the TED Talk, Dr. Burke also did an interview with Oprah Winfrey. And Oprah had actually come out with a book that she co-authored with a doctor, and it's called What Happened to You? And her whole premise is the idea of let's stop asking people what's wrong with them and let's find out what happened to them. And it's kind of like what you were talking about, Jody. Really, really, oh, there it is. Yes, that's the book I'm reading right now. Really, I mean, just a really impactful book. But Jody, it's like you were saying earlier today when you and I were talking about that too. Being curious, asking the why. Like, why are these things happening? Why do we have these health concerns? Why is there the high rate of suicide in our young people? Really asking that question.
Yeah, I think especially, if people experience trauma as children and then they maybe have packed that away or, whatever, then they fast forward to adulthood and they're experiencing then the aftermath of that in their health outcomes. It's taking that step back and asking why. I wonder why this is happening to you. What was it that you've experienced in your life that could have contributed to this? And I think it's important to also recognize that these ACEs can happen perpetually, generation after generation after generation. So unless we look at it from a big picture, it can really, evolve years to come. And that's one thing that I think as communities, we can address this publicly as a public health crisis and identify what are those programs, what are those assessments that need to be done, and that what policies can we implement in order to address these together.
The awareness of it is so key. We really wanted to bring that to everyone today to really, plant these seeds and help bring awareness to our audience and to people that are connected to us. It's just such an important topic. Jody, I did want to ask you a little bit about, if you don't mind sharing with our audience too. I know that your team has, you have a couple people that are those community healthcare workers out in the school, kind of addressing some of those social determinants of health. Do you want to share a little bit about what that looks like and what your team is doing?
Sure. We have 2 wonderful community health workers that are based in school districts that help to deal with these exact things. So if we're seeing the symptom of one of the problems, whether it may be they're truant in school or they might have illness, they're not showing up to school or maybe have behavioral issues, it's helping to just ask those questions like, what happened to you? What might be contributing to some of these underlying problems? And then we as a healthcare system can look to align our resources, make sure that folks are getting their basic needs met. And certainly the 2 great community health workers that we have, Chelsea and Melissa, are doing just that. So identifying these gaps or even some of these ACEs, bringing increased awareness to the supports that are needed for the school district staff, but then taking it one step further and linking them and their families to the resources, much like Charles, who can provide that support and help guide a person to getting through these issues. You're on mute, Linda.
Maybe I should unmute myself. That's a good idea. One of the things that I had highlighted from the TED Talk as well was when Dr. Burke was talking about educating parents of the impact of toxic stress and how often we make sure we have all the physical things covered, right? We cover the outlets. We make sure that there aren't things on the end tables that kids can knock off and hurt themselves with. We look at protecting our children physically, but this is also about educating people and helping protect them emotionally and how important that is. Charles, thoughts on that?
Yeah, I think that's what it all comes down to. And part of what I think the education and the awareness and everything is so important. I like this phrase, which is knowledge is power. When you know better, you do better. But for the most part, we are so still a society most organized around physical health. And we just think whatever mental health we have, that it's either going to be what it is, or if there's something not there, it'll take care of itself. But understanding the connection between these events, and physical health is one thing, but the connection to mental health is another thing. And why I think the earlier we screen for these and that we can make it, something that people have more knowledge of to be more strong in the way they approach it, we could be better. I want to talk about something else with that if I can, but while I have it in my hand, I want to highlight another book, which is This is The Body Keeps the Score. And this is another book about trauma and what we can do with it. But the What Happened to You book that was published by Bruce Perry along with Oprah, that movement started from their understanding of this. It actually took place in Milwaukee. I think it's St. Anthony's maybe, or St. Anne's, a program where trauma victims, the question never was, what's wrong with you? It's what happened to you. Let's understand what happens. It pathologizes it much less that there's something wrong with you, and more of let's understand, let's figure out what has happened. And if we could deal with that more effectively, we can. There's one other thing that I want to highlight, in that in the where we go with it and what we do with it component in perspective, is how much relationships matter. And if there is something even slightly anecdotal or helpful to this, we might not be that perfect magic wand type of antidote, but it's this thing where relationships, we know, more than ever matter, because difficult relationships that created the trauma most of the time, having relationships that can heal the trauma is where the benefit comes in. So if we think of it from the mentality of every single interaction we have is essentially a physiological experience and event, that the more positive physiological events, positive interactive experiences we can create, the better we are going to be. And if from a family standpoint, the earlier we know that, the better. If we know our son or daughter is experiencing some trauma, we have to ramp up those physical opportunities. And some of the belief of some of the epidemiologists about why these events are as traumatic as they are, first of all, they're traumatic in their own right. But some of what we're finding out is they're even more traumatic if your baseline of trauma or love that you received the earlier in life wasn't there, the amount of consistent interaction wasn't there, the greater the extent the trauma is going to have on you. So parents, families, the better we could ramp up love, value, appreciation, telling people how much we love them. And Dr. Perry, the person you're talking about, he goes as far as to say the biggest difference from a generation or two ago is what's taking place in the first year of life, where the greatest amount of brain development is happening, and that we have to be even more purposeful, deliberate, and intentional in the amount of touch, the amount of love, the amount of caring that goes into that first year, where our susceptibility to trauma is becoming much more developed than any other phase or stage of our lives. So there's maybe not prevent trauma for sure, because look, we're all going to be impacted, right? By it. None of us get through this life unscathed. We all get sick at some point. We all experience grief at some point. We all deal with something at some point. It isn't that we can get rid of trauma. It's how well we fortify ourselves to deal with it, and then have the meaningful, positive, interactive, positive and rewarding, positive, rewarding, positive, rewarding, attached, super attached, healthy relationships. If there is something that's going to help us through this, through these ACEs, is going in that direction. But unfortunately, last thing I'll say is the science tells us we're going in the opposite. The more self-absorbed, the more phone distraction, the more we move away from that. We have gone from a family system that just keeps going lower and lower. And right now, the most prominent family numbers is less than 3. And one other negative thing, when people are asked in an emergency, who would you be able to contact? This isn't the average, but it's the most commonly stated number. Anybody want to take a guess at what that number is? That in an emergency, who would be most available and who would you like us to contact? Guess what the number is to that question? If you're thinking it's really low, you're right. And that answer is 0.
Really?
The most common response to that question is, I don't have someone that you can call if something happens to me. That's the number, which tells us we even more have to be doing what we're talking about. Cultivate, working, knowing that relationships matter, and our relational health matters as much or more than anything else when dealing with the effect of ACEs.
I agree. Charles, everything that you're saying is, to me, like, to summarize it as knowing what the risk factors are, but focusing on those protective factors. All of those protective factors that you listed off help lead towards resiliency, and also kind of pulls away from some of the pathological talk that we tend to focus on when we're looking at a problem. But those protective factors really lean a person into what's possible. What's possible if we had more love and communication and touch and support and bonding together and building those relationships? What could be possible? And I think that's where we need to start looking.
Yeah,
Well, I
so
think that
we know better, we do better. And part of this today was, I hope, was turning, taking the cover off this, hitting unmute with this, because I think the mute button has been on way too long. And I want to go back to Linda, you really captured one really important part of this study. And by the way, this has been replicated a number of times, and Bruce Perry has actually worked with Kaiser and the World Health Organization about what to do with it and looking at other studies with it. But one of the things Nadine Burks is highlighting with it is, it seemed like at first this was one of those, oh, well, this is a poor person problem, who these people who just have, okay, well, maybe it's in this neighborhood or maybe this, but these were 17,500 highly educated, primarily Caucasian, and they still had these. And by the way, I'd encourage anybody to take it. You might be surprised at what number you get. I know anybody that I talked to has taken it, was like, yeah, I was kind of surprised. I thought I had like a pretty great childhood, and I think I did, but it doesn't mean we don't have exposure, right? It doesn't mean we haven't dealt with stuff. So it's taking it, knowing it. But her theory was, once she got all the data and understood it, came to think it wasn't a problem we weren't dealing with, because this is maybe a poor neighborhood problem. It was more like, maybe we're not dealing with this because this really is an everybody problem. But the more we approach it that way and look at it, like Bruce Perry talks about, is more of a transgenerational thing, is look at it from a perspective of, if anything I'm doing right now in my own change world. So if all of you can think of it this way, what am I doing to be the best me right now? What am I doing in any change that I'm making to make me better tomorrow than I am today? And how might it make the rest of us better tomorrow than today? Because every generation is reinventing the next one, what the culture is going to be like. And the time for this to get better is now, which is why it's an everybody problem rather than a certain geographical location problem. We all have a role to play in this, all being better together and being the best that we can be, not only for ourselves, but the people important in our lives and then beyond it.
Well said, Charles. And I think the one big takeaway I just want to point out today, and I think this is something that all of us are able to really look at and potentially have an impact, even just in our own little corner of the world, is the idea of relationship and connection. So when somebody is having a bad day, or if there's somebody in your life that you know is struggling, taking that time to reach out and to be that person and to give them that relationship, just to connect as human beings and to say, hey, what's going on? Or is there a way I can help you? Or do you need to talk about something? It's so valuable. It's so incredibly valuable. So even as we have a very, large, truly public health crisis, in this scope, hopefully people can also know maybe there's something small that we can do in our own corner of the world.
I got to say something on that, Linda, because what we know of it is it doesn't have to be a big thing. It's a dose response thing. The smaller it is, the more frequent. It isn't like once every month check-in. It's those little doses along the way are the things that we know from a scientific standpoint are best going to help overcome those. The consistent, repetitive thing, the brain's learning is use dependent. The more it's used. So it's like, for example, you can't learn piano once every 6 months. You got to be doing a little bit every day. You can't learn a language once every 6 months. The more small, the little things you're doing every day, that is where we change the brain's response to the trauma we had. That little bit every day or every couple days, whatever we could do, that's what's changing the neuroplasticity and helping overcome the trauma. But part of the problem is, and why I'm so happy that you said what you did, is we have become a society where it's, well, I don't want to bother him if he looks a little bit, or I don't know if I should say anything to her. Or it's, well, so we have this thing that we err on the side of not touching base or asking. Like, I don't want to ask, Jody's way too busy, Linda's way too busy, I can't ask for that. Charles is too busy, whoever it is, they're busy. They're dealing with their own stuff. So it creates this impasse to those quick interactive responses. And as I said, that increase relational health. Instead, we decrease relational health because of that impasse where we believe we're both too busy to either offer or to ask for. And as a result, that positive physiology that I described from our social interactions, we don't get any. And then we have the loss, and then just the intensification of the trauma or little traumas that we have, which is maybe one last thing I want to say. These traumas don't have to be the big T traumas, like the natural disaster or a terrorist attack. It's more these little T's that they might not be that big that one day, but every day when we keep having that dose response and the negative experience of it, even more why those positive dose responses of favorable interaction are so critical.
I agree. Charles, I just want to jump in and say, what you mentioned about reaching out to a person and some apprehension that people might have based upon what they see. And I would encourage people to ask themselves, what's the risk if I don't? What's the risk if I don't reach out to this person and try to support and connect with them? And that's where we will lead into those negative outcomes, but we do have an opportunity right down to that individual level to make a difference in somebody's lives and support building those protective factors and support resiliency.
Let me say one last thing, because that is, I got to double click. Jody, awesome. Perry thinks that the thing that this all comes down to is empathy. So even if you take that risk, and even if you don't get anything from it, and the person says, I really don't want to talk about it, the very fact that you had enough empathy to show you cared, it doesn't even have to really go anywhere else other than that single event in and of itself is what it's all about. We notice, we see, we care. I was thinking about you. And if there is a time you want to talk, I want you to know I'm here for you. That's what it comes down to. That's the care. That's the value, showing each other how much we all matter and that we have empathy for them and that we're there. That's what it's all about. And that's how, if we are going to get over this and through this, this is how we do it.
Absolutely. Well, such great points from both of you. I so greatly appreciate this discussion and the expertise that both of you bring to the table on this topic. So much great content there. And as I said, we're going to continue this discussion in some upcoming segments. We're going to dive deep a little bit more into some of these things and how things are connected in our community and here at Bellin. Next month, we're going to be focusing on, it's May, so it's Mental Health Awareness Month. And we actually have a special guest that's going to help us talk about perfectionism. So we're looking forward to that conversation as well. But Charles and Jody, thank you so much for taking the time today and being with us and helping us really dive into this really important topic.
Yeah, thanks for bringing this conversation to light. And I really encourage folks to click on that YouTube and watch it, to, click on the ACEs screening test just to see where you fall, or it might prompt you to think about maybe somebody that you care about or that you love that maybe you need to extend some outreach to.
Definitely, definitely. Well, thanks so much. Thanks to our audience for taking the time today. We hope you get out and enjoy this beautiful weather, and hopefully we'll see you next month. Take care, everyone.
Thank you, everyone. Have a great day.